All right. Okay. So thanks everybody again. I feel like I've said that like 3 times. But I'm glad y'all are here. Seriously glad y'all are here today. Happy May the 4th be with you to any Star Wars humans out there like my family is. It's a good day to have a meeting. Yay. All right, so we're going to start with our community calendar review. There are a couple things on the agenda to look at, a couple of CHIPS events to look at, and then we'll open the floor to anybody else who has something that an event, activity, whatever it is y'all have coming up that you want to share.
You say you were wanting information from people, Jillian?
Yes, feel free to share whatever you've got coming up or what events or activities you've got going on.
The long awaited conference for the veterans and substance use disorder is now right around the corner, May 25th, 26th at the DoubleTree, 2 days. A lot of great speakers, a lot of panelists, people involved with this coalition are really involved, really taking part, taking the lead. Folks from Carter County are really taking the lead in a number of the different panels. And so I put the QR code and then a free 2023 promo code for people that can attend and want to pre-register. We're trying to use pre-registration for continuing education for health professionals and also for getting an idea how much food to order. And I'm really excited about finally having something else to claim that we're doing successfully in this area, and this time including our veterans. And I can put my phone number in the chat too, in case people want to reach out to me.
So this is Tia, and I wanted to announce, so Bridge to Shore is having a fundraiser on June the 25th. We're going to have some good music, good fun, and also some good food. So it'll be at the Hickory Tree Grocery, and I'm going to put the flyer and the Eventbrite link in the chat. And so all of the proceeds will benefit women living in sober living in the community.
I loaded this on our agenda, but just again, I want to share the Elizabethton City School Back to School Bash for 2023 is going to be July 31st this year. It's going to be on a Monday evening instead of a Saturday. We'd love people to sign up for our resource fair, and I can put that link in the chat if anyone wants to have a table at the event. It's going to be inside Elizabethton High School. And also we're still accepting donations to get those school supplies if you want to sponsor any of our students. I put the donation letter on the agenda. So we have until the end of May if you want to be a sponsor and get your logo for your business printed on the tote canvas bag that we're going to give everyone that shows up to the Back to School Bash. Also, you can email me or reach out if you have any questions. Thank you.
Emily, was that you that just gave that announcement?
Yes, that was me.
Okay. I would love to participate on that. If you could send me some more information, I'll put my email in the chat.
Yes, absolutely.
Since I was already talking, I'm gonna let you all know that Tennessee Voices actually is doing a See Me, Hear Me art event to bring mental health awareness to the community. I do want to let you know that we did the art project at Kid Power this year, and we had a great response. We're going to have the art displayed in 4 different locations, which is the Johnson City Library. We are going to be doing Appalachian Promise, the Langston Center, and also the Hands-On Museum. So I know that there was a lot of kids from all over at that event. So if you want to go see some of that artwork, it's going to be displayed in those places. So we are also accepting referrals for Statewide Family Support Network. Our program helps families that have a need with an IP or a 504 in the schools. We also support them if they have a case open with DCS or the juvenile court. Our job is to help them advocate for their children and their families. So if you have any kiddos that may benefit from this program, it is completely free. So please just let me know, send me an email. I will be happy to give you more information. And or you could just go to tmvoices.org to fill out the referral. That's all I got.
I will go next. Can you all hear me okay? Okay. I just want to remind everybody that the Carter County Collaborative has begun their county health assessment. Surveys are out into the community. We are trying to get as many surveys back as possible from Carter County residents. I just put the link to the survey in the chat. Currently, we're sitting at 42 completed surveys. And in the Committee C breakout room today, we'll be kind of going over what we have so far and what we're looking to get in the next few weeks. If you have time, please fill out the survey. And if you know of anybody in the community that has not taken the survey, please give it to them. And I have extra resources for these surveys, such as flyers, links, paper surveys, and the survey also is available in Spanish. So if you need any of those resources, please reach out to me. Thanks, everybody.
Hey, Tyler, this is Randy.
Oh, go ahead, Randy.
I just have a question. I just have a question for Tyler.
Yeah.
I'm not a resident of Carter County. But I do some work there. I'm assuming you want to limit this to residents only. Is that correct?
Yes. They have to have a Carter County zip code. Now, if the zip code does fall in one of those kind of in between, where it could be Washington, it could be Carter, we won't discriminate. We'll keep everybody's zip code if it's on the line, because I see it as, those folks that are living on the line are probably getting resources from both counties and benefiting from both. So we'll keep those. Thank you, Randy.
And just to piggyback on what Tyler said, I also have copies here at the Carter County Health Department. I can bring paper copies wherever you need me to. I can also send you flyers or bring flyers to you personally. So if you need me to bring them to you, please reach out and I'd be glad to do that.
And piggybacking off of Shauna, I did drop off a whole bunch of paper surveys at the library as well in Carter County. And they keep those there for anybody wanting to come in and take a in-person paper survey rather than an online survey. Thank you all.
I just want to say, Jane, it's so good to see you. I feel like I haven't seen you forever. It's great to see you. Tyler's done a good job filling out your shoes, by the way.
I'm going to share a couple things we have coming up at Carter County Drug Prevention. The first thing I did want to mention, thanks Tyler for all the work, and Shauna and everybody else for all the work y'all are doing with the community health assessment. If you had volunteered to do a listening group or a key informant interview, I did send you an email this week, just with the listening guide and a reminder and all those things. So if you need anything else from me, please let me know. Also wanted to share a few upcoming events that we have at Carter County Drug Prevention. we are doing an esports. We have an esports lab at Elizabeth and Parks and Rec. So the facility down on Mill Street, near the River Riders Stadium. We are going to do open esports labs all summer. So if you know families that would benefit from just coming in, we'll have somebody there to share resources as needed. But mostly it's just a super fun room. Listen, y'all don't want me talking about esports because I don't know what I'm talking about, but I know we have gaming consoles and TVs and cool chairs and all kinds of stuff in there. So they're welcome to come just have a free fun activity for the summer, every Monday, Wednesday, and Friday. We're also doing our annual Major League Baseball pitch hit and run and home run derby contests. We've done these for the last several years, just another fun opportunity for kiddos to have something to do in our community. We also have several Safe Sitter classes coming up this summer. So these are generally a $35 charge, but we never turn anybody away that can't pay for it. So if you know any kiddos at all, it's really great for, I'm going to say starting in 5th grade or so, all the way through high school. It's a great class with lots of life skills, business skills, first aid, CPR, all the things. So if you have a kiddo that would benefit from that, please let us know. We've got several different classes coming up. And then I also wanted to share that July 14th, we're going to do a drug take back with the Elizabeth and River Riders. So that day, the first 100 people who come through the door will get a lockbox to take home with them. We'll also be doing a drug take back. So if there are anybody, any families who want to clean out their medicine cabinets on the way to the baseball game and just come hang out, we will have all of that going on too. So lots of events. I put the Facebook event link in the chat. So hopefully most of them are on there for you and an easy way to share. But if you need more information, just let us know. And anybody else have something they want to share before we move on? Okay, friends. Well, I am going to turn it over to our awesome speaker today. We are excited to have Jane back with us. We've missed her face being on this call with us. So excited to have Jane here. Jane, I'm going to just make you host for a little bit so you can do whatever you need to do with sharing.
Okay.
And I will turn it over to you.
Bye-bye. Okay, let me see if I can figure out how to do this. Well, it's so good to be here. I love seeing all your faces and names. It's been way too long. Let me see if this will work. Can you all see my screen?
Yes, ma'am.
Okay, great. Let me see. There we go. We got it from the beginning. Let me see if I can move that a little bit. So I wanted to share some information about what I've moved into with the Medical Reserve Corps. So I just wanted to take a few moments to bring up the question, what are you doing to prepare for the next emergency? We don't necessarily know what it is or when it's going to be, but there are ways, some tips and tools and education we can all do to be more prepared than we are right now. How many folks are familiar with the Medical Reserve Corps? I'll need you to speak up. I can't see if people are using any icons or anything.
I am, Jane.
I am.
I
Cool.
am. Me too.
I am.
Oh, good. I'm glad there's a bunch of you out there. I appreciate that. And for those of you who aren't, I hope you will leave learning a little bit or knowing a little bit more about who we are and what we do. And if you are familiar with us, I still hope you learned something new. But the Medical Reserve Corps started shortly after the terrorist attacks in 2001. And it turned into a way at the national level for to recruit and train and activate teams of volunteers to help whenever there's an emergency or a natural disaster. Essentially, the volunteers work shoulder to shoulder with the public health workforce or with first responders. They've been trained, they understand what's going on in the chain of communication and the chain of command. And once folks have been registered and vetted and gone through training, they are covered by an insurance policy when they are activated and helping out. So it's nice to be able to offer that to folks. Our name can be misleading. We call ourselves the Medical Reserve Corps, but about 60% of our volunteers are non-medical people. We absolutely take everybody and anybody who's over the age of 18 because they offer some sort of skill that can be helpful either administratively or in whatever skill they're bringing. Some people join for the free training. They're building their resume, they're building their professional networks. And then when something comes up, they're a lot more confident to jump in. The pictures I've included are some of the things that we've been doing. On the left is the Jonesboro water system emergency that took place between Christmas and New Year's of last year. And then on the right, we always invite volunteers to come to exercises and trainings. That's a radiological emergency training that took place last September. And there are about 750 units across the nation. And that's a little bit more than 200,000 people. And the picture above, you can see the team that helped out during Fight Flu TN. There was a mobile vaccine unit that helped out at the Salvation Army in Johnson City, giving not only annual flu vaccines, but COVID vaccines and monkeypox. And in Tennessee, the MRC units, Medical Reserve Corps, follow the public health structure. So there are 13 units, one for each of the regions or metro areas. And in this region, we have a little bit less than 400 volunteers. And the little picture on the lower left is a group of volunteers that were registering and supporting the mental health conference for first responders last November. And then on the lower right is, I don't know if folks know Mr. Chris Haichu. He's a Carter County resident, and he was teaching the Readies at the courtyard in that picture. We serve, our Northeast region is in the light blue, so the 7 rural counties, and we work closely with Sullivan County. There's a Northeast Region Healthcare Preparedness Coalition, and all 8 of those counties are coordinating. Next week, we are going to be working on a full-scale hospital surge exercise, and I'll give a shout out to Jillian and Shauna and Tia, who've been helpful in recruiting folks for this. I know Tia is going to bring some of or her daughter and some friends to Niswonger to play victim volunteers, and Shauna will be in Carter County acting as one of the victim volunteers. So I want to thank you all. The other colored counties are highlighted there. Yellow is Southwest Virginia and green is North Carolina, because we also work as a region across state lines to prepare for emergencies, since they don't necessarily honor our county and state lines. We have rapport, we know each other, we practice working together. We're going to do an exercise across the states with a ChemPack later on this year in September or October. And then why do we need you? As we're saying you because as you're thinking about preparing for your next emergency, the more prepared you are personally and as a family, the easier it is for you to jump in and help out your neighbors and your coworkers and your church family. So the types of things that our volunteers do, I've mentioned some of them when I was sharing the pictures, But the point of dispensing pods, some folks helped out during COVID with traffic or giving vaccines or answering, the point of dispensing pods were during COVID. And then also distributing the water for the Jonesboro water emergency. Volunteers were putting cases of water in the back of people's vehicles. For medical sheltering operations, we always coordinate with the Red Cross because they do the shelters throughout the state of Tennessee and they help in other states. Our nurse strike team that also includes some volunteers has helped out with the Gatlinburg fires back in 2016 and also Hurricane Matthew in one of the responses in North Carolina. And I mentioned some of the exercises and drills. Our volunteers are always invited, and it's a great learning experience. That's why some of the youth are also participating because they learn about what happens for exercising. So when we do have an emergency, they can be rest assured that there are entities in the community that have already practiced to do the best they can to help out. And then the support for catastrophic event, I've mentioned some of those. And a lot of times volunteers are behind the scenes at some other building out of the actual emergency, but providing a lot of different administrative type support. And volunteers can be used by the health departments to help out with routine events. And they're also providing administrative support. There's some folks who enjoy doing that type of work and they put their talents and skills to use, helping on a weekly basis, simply run the program, helping with reporting and data tracking or putting together some materials for our community education. We have a class called the Readies that's about an hour long that we bring out to any group that wants it. So when I mentioned Chris Haichu, that was the class he was teaching at the courtyard. And then community assessments, or even earlier this week, I was at a training and one of the Carter County volunteers was handing out some of those paper county health assessments for this group and Tyler. So they help out in so many different ways. The volunteer mobilizer is how we notify people about things that are going on. So people register at the tnmrc.org. So if anybody's interested in learning more, that website has information. And then if this seems like something you might be interested in doing, you can scroll to the bottom of that page and register. We always tell folks, especially when they put in a phone number, this mobilizer sends an alert. So once a month we test it and people will either get a phone call if they've left their phone number or an email or a text message. And we always let people know if you are registered, please put that phone number into your phone so you don't think you're getting a call for yet one more car warranty. So, and you do expect the call once a month, but when something happens, like when the Jonesboro water system failure took place, we alerted folks and said, we've got this emergency. We're going to be putting out a call to mobilize volunteers. Please let us know if you want to participate. So that's how we communicate. On the left-hand side, that's another photo of the mobile vaccine unit that was at the Salvation Army. And on the right-hand side, that's the Readies class being taught at the Department of Intellectual and Developmental Disabilities housing staff out in Greenville. And then we talk a lot about making sure that the volunteers are trained, and we have different teams for different types of events. So NIMS and ICS, admittedly, we're terrible about using acronyms. The National Incident Management System and the Incident Command System are what NIMS and ICS stand for. FEMA, the Federal Emergency Management Agency, has these courses online, and we ask that all volunteers take 4 classes and get the certificates. Those are trainings not only are useful for when we're responding to an emergency, they're great resume builders, and they're great for professional development. Already mentioned that folks do drills and exercises, and if nothing else, it hopefully is reassuring for you to know that we're constantly communicating and practicing for all different types of hazards so that we can respond as professionals and as volunteers in collaboration with all the other first responders and law enforcement and local government officials and higher level government officials to make sure that we can limit the loss of life and property when something happens. Mental health first aid has really come into its own. We learned a lot during COVID about how mental health is greatly affected by the trauma taken on by everybody going through these events. So if you're not familiar with that, that's an 8-hour class that provides a certification, much like first aid and CPR do. And mental health first aid needs to be recertified every 3 years. I've got a colleague, Melissa Taylor. She's in that bottom picture in the red sweater. If you know her, you know how amazing she is. And she's almost single-handedly brought mental health first aid to the state of Tennessee. She started a pilot program in Northeast Tennessee in 2017. And this year they're rolling out mental health first aid across the whole state. All Tennessee Department of Health employees will be certified on an ongoing basis. And they're also doing instructor trainings across the state. So we can provide the training to community partners. So hopefully by this time next year, any of you in the community representing an agency should be able to ask to have somebody come and teach the class, and we can get your folks certified in this. Mentioned the readies to you already. And then when folks respond to any type of exercise or event or are activated in an emergency, we always do just-in-time training. Talk briefly about mental health first aid already. Our hope is to make it as common as CPR. The class is targeting anybody and everybody in the community that can come across somebody who's having an acute mental health crisis. It may or may not include suicide ideation. And during this class, we do talk about suicide and how to speak with somebody who is talking about suicide. And the goal is to be knowledgeable and comfortable enough to be with the person who's having a crisis until the help can get there, much like a regular first aid class that you would take, and you would be the person there with them until EMS arrives. The Readies is the hour-long class that we bring out to the community. It's billed as a class for folks with access and functional needs, meaning they either have challenges with transportation to get to healthcare appointments or other social services, or even to the grocery store to do regular household chores. Functional needs could be as simple as these glasses or any prescriptions that you take, up to chronic medical conditions, folks who need oxygen or use CPAP machines while they're sleeping, durable medical equipment, canes, walkers, wheelchairs, any mental or intellectual disabilities that it falls under there. We teach this to as many people in the community as we can. A lot of what we talk about is why should I prepare and how do we go about preparing? We talk about the 4 steps that are almost at the bottom of every single slide, to be aware of the emergencies that can happen to you in your community, plan for them ahead of time, prepare your emergency supplies in your go bag, and connect with community. And then we spend some more time specifically talking about preparing your emergency kit, and then revisiting it every few months just to make sure that it's adequate for you. So if you need to update it, or if you need to put some different things in your go bag. So if you need to leave your house in exactly 1 minute, that you can grab that bag and have things that you need with you. And then this is just my information. If you want to get in touch with me, my email has stayed the same, but that phone number is a different phone number than the one you may have on file for me. If if you haven't talked with me since I moved into this position. And then anybody who's interested in learning more, if you don't want to talk to me, but you want to check out the website, tnmrc.org, will get you there. I'm glad to answer any questions. Well, I thank you much for your time today.
Thank you so much, Jane, for being here and for all you do for our community and for our region. It was really great information. I am going to ask if our 3 committee chairs would maybe share just a little bit really quick about what y'all are working on, and then we will get into our breakout sessions. So Committee A, do you want to share what you're working on and any ways that members can be part of what you're doing?
Hey guys, so today we're just going to be talking about getting vendors at our overdose awareness event that we're going to put on August the 31st at the Covered Bridge Park. So if you are interested in being a vendor at the event or giving out resources to the community, or would just like to be a part of it, that's what we will be discussing today.
Thank you, Tia. For Committee B, Megan is not here today. She is teaching a class. So she said anybody in Committee B, if you all would just remember to please send her the resources that y'all were working on compiling. She's going to work on that. So Committee B will not meet today, but she does want to remind everybody, if you have resources that you would like to be compiled into, I think, a larger resource directory, please send those to Megan. Her email is Megan, MEAGAN, at cartercountydrugprevention.org. And Emily, want to share what's going on with Committee C?
Yeah, in Committee C, we're just going to do like a quick update on our community health assessment process, checking in on our survey responses and our interviews and things like that.
Okay, thank you so much. All right, so I'm going to go ahead and maybe open the breakout rooms. I can get it to work with us. And if when y'all are finished in your breakout rooms, you are free to go. All right, give me just a second and I will get them opened.